Okay, the three most important aspects of doing a wound in general practitioners' rooms or even in my office is to explain the nature of what you're going to do. Make sure the patient lies down. You should never do a procedure on someone sitting in a chair or someone standing up. And the third most important thing is to explain to them what you're doing and the fact that there will be some pain, but generally they won't feel pain after the local anaesthetic works. Now, with children, it's a different aspect of practice. First of all, you've got to have the parent or a guardian with them. Second of all, you've still got to explain to the child what you're going to do, and you've got to accept the fact that the child is going to be frightened and the child's going to cry. And you have to really judge whether it's appropriate to do them in your office or it's appropriate to send them to a hospital where they can be sedated. You would never sedate a child in your general practice because you don't generally have resuscitative machinery there for them. With elderly patients, it's not a problem, it's just a matter of explaining. And the other important thing with elderly patients, make sure they have an escort, so when they go home, there's somebody there. And you have to have all the instruments and all the facilities that you need ready. And most elderly patients will tolerate procedures very well. Everybody is anxious. Everybody that has a procedure is anxious. So the most important thing to reassure them is to explain to them what you do and to show that you're confident and you know what you're doing. If you explain to them and you tell them that there will be pain with the local anaesthetic, but afterwards it will go numb, nearly always they will say, oh, that wasn't so bad. But if you say to the patient, don't worry, this won't hurt a bit, and then you give them the needle, they may jump. So it's just a matter of explanation and reassuring them, and perhaps having the nurse, if you've got a nurse, just holding their hand while you're doing the procedure. You say to the patient, this is a simple cyst, I can do this very easily, and I'm very competent at doing it. So I believe that you've got to show confidence that you're able to do it. If you start trembling or sweating or starting to get a bit anxious, the patients will not want you to do it. The other thing to do is often, if you have, say, I've done many of these and the success rate is very, very good. Most patients will not develop an infection as a result of a procedure in the room. And you say to them that if I don't feel I'm going to do it, then I would be happy to refer them to you. The most important thing is confidence.